Hospital in Washington, D.C. Today we did a symposium on NF1-Associated plexiform neurofibromas and new treatment options for patients who have these tumors, including surgical approaches as well as medical approaches. There are about 1 in 3,000 patients born with NF1 each year. And NF1 is a syndrome that has variable expressivity but can sometimes have mild symptoms and sometimes can have very significant symptoms, including the development of plexiform neurofibromas, which are tumors that form along the nerves in the body. These tumors can form along any nerve, and if they form along the nerves along the spinal cord or along some of the nerves in the cranial region, they can actually be very significant for patients and can cause neurological symptoms, including weakness and paresthesias. For a long time, the only treatment for plexiform neurofibromas was surgery. But with surgery, sometimes there are risks and complications that can happen. And then we also know too that after surgery, oftentimes these tumors will maintain their growth potential and they'll continue to grow even though we've had a really good, or what we thought was a really good, surgical resection, which can be very difficult for some families because you go through the surgery and then the tumor comes back and you have to potentially go back again. So over years, we've learned that NF1 is very important for regulation of a pathway called the RAS-MAP kinase pathway. And because of its role in that pathway, where it's not quite doing its job and the pathway is more active than it should be, so cells are growing when they shouldn't be, we found medications that can actually target other proteins in that pathway that can slow it down, or they can tell those cells that they need to stop growing because the NF1 is not doing its job properly. So these medications are MEK inhibitors, for example. There's also some tyrosine kinase inhibitors and some other types of inhibitors that we've been using. And we've actually seen some fairly good success with some of these treatments, in particular the MEK inhibitors. Because the MEK inhibitors have been so successful, they are now FDA approved for the management of plexiform neurofibromas in patients with NF1, and they can be used by themselves or hopefully along in conjunction with surgery to help with the management of the patients who have tumors that are particularly difficult to treat. There are a lot of new things that are coming out for patients with NF1. This is one of them. In the future, we expect that there'll be more clinical trials, new drugs, new different types of treatments that come out. But we're very excited about some of these new options for patients and hope that in the future we'll be able to expand our treatment to include both medical and surgical options for all of our patients with NF1 who need treatment. Thank you very much.